I'm Dr. Neela Mukhopadhaya. I'm a gynecologist and I'm based at the Luton and Dunstable Hospital, where I'm a full-time NHS consultant. My private work is at One Hatfield Hospital, where I'm here every week, and my interest area is recurrent miscarriage. So people often ask, what is recurrent miscarriage? And by definition, recurrent miscarriage is 3 or more consecutive miscarriages less than 12 weeks, or if you've had one miscarriage more than 12 weeks, and these should be investigated. The reason that's important is many of these can be avoided. However, if someone is over 35 years, I do feel that after 2 miscarriages, you should be referred. And I just wanted to say how common this is. About 1 to 3% of couples will experience recurrent miscarriages. So as human beings, we are actually remarkably inefficient in our reproduction compared to animals. Like 70% of the conceptuses will not survive to live birth, and 50% will end before a clinical recognition of a pregnancy. And there is a multifactorial etiology, causes of miscarriages. It is quite a devastating condition, and there are still no clear solutions. And obviously there's a lot of research and publication, and the internet doesn't help. It leaves everyone so confused. So if you think about the causes of recurrent miscarriages, it's very common in older mothers. So if you look at pregnancies over 40, nearly 50% of pregnancies will miscarry because of genetic abnormalities. There is something called sticky blood syndrome, which is because of thrombophilias, which some moms will have, and that can be treated. We also look for other conditions within the uterus, such as fibroids, septums, polyps, conditions such as diabetes and thyroid disease. Other immunological conditions, if somebody has a diagnosis of lupus or rheumatoid arthritis, then this can impact on recurrent miscarriages. Environmental and lifestyle factors also do have an impact. However, nearly 50% of miscarriages will be unexplained, but we still should investigate into them. So in terms of treatment, every patient will have to have a tailored treatment based on the investigations that we have done for them. The treatment options range from medical or surgical. So in terms of medical treatment, there are various options such as heparin injection, aspirin, progesterone, steroids, thyroid supplementation, folic acid and vitamin D. And not every patient will need everything. We have to look at the test results before we advise you on those. There are a group of patients who will need to have surgery, which again can be offered at One Hatfield Hospital. So in terms of surgery, if somebody has a fibroid or a polyp or a septum within the uterus, they may need a laparoscopy or a hysteroscopy to remove that. Certain women who tend to miscarry after 12 weeks, they may need a cervical stitch put in, so which is where we put in a suture at the neck of the womb, which is roughly at about 13 to 14 weeks to prevent a miscarriage. So all of these options have to be tailored in to the management plan, and they can be offered at One Hatfield Hospital. In terms of other advice that we give to patients with recurrent miscarriages, it's so important that you have a healthy lifestyle. If you are obese, you should lose weight and stop smoking. And if you take too much alcohol, then that should be reduced. Particularly, certain antidepressants and some medications can also be detrimental and can be an implicating factor for miscarriages. And above all, I always tell my patients, you have to be in a positive frame of mind. And there is actually emerging research about being positive in your pregnancy. And we all know that women who have had previous miscarriages will be anxious, but that's where our role comes in to support you through that time. So recurrent miscarriages has been a very special interest area for me. I have participated in national research trials such as the PROMISE trial, which was the progesterone in miscarriages, and the VESPA trial. I have a huge workload in my recurrent miscarriage clinic for the last 10 years, both in the NHS and the private sector. Your GP can refer you to me for a full investigation and a management plan for pregnancy. Usually I will see you very regularly until even you're pregnant, until you get to 12 weeks. And I support you through that time, which I know is extremely anxious time. And most patients are so worried in the first trimester, and they will require those repeated scans and support. But my final message to everyone is always that the chances of future pregnancy is about 70 to 75% in all age groups, no matter even if you're over 40. Unfortunately, you have to fall pregnant to be successful, and be positive and remember that there is support for you there. So please do seek that. Thank you.